Hi, I get a lot of questions from patients regarding the different types of grafts used in rhinoplasty surgery. Cartilage grafts are frequently used to stabilize the nose, and there's requirements for grafts in different situations. The first graft I'd like to talk about is a spreader graft. It helps fix a crooked nose and a narrow nasal valve. In the first patient, you can see there's a collapse of the side of his nose and he can't breathe through that side. We put a spreader graft in between the upper lateral cartilage and the septum. His nose is straighter and he can breathe better. This is a diagram of where the spreader graft goes. The spreader graft is green in this diagram and it's placed between the upper lateral cartilage and the septum. It could be on one side or both sides depending on the situation. The next example is a young woman who had a nasal fracture and a collapse on the left side of her nose. A spreader graft was put in on the left side only. Her nose is straight now and she's breathing better and the nasal valve is wider. And this is a view from above. You can see preoperatively the nose is crooked, and on the right it's narrower and it's stable and it's in the midline and she breathes better and it looks better. This is another gentleman with nasal valve collapse on the left side. A spreader graft was put in. His nose is more symmetrical, he breathes better, and you can see from the bottom the septal cartilage was also centered, improving the function of the nose. So spreader grafts are very important in improving the breathing and making the nose look straighter.